And welcome to another segment of Your Health with MU Healthcare here on AM 1340 KXEO. Special guest with me this morning, and I'll let you give your own introduction and tell everybody who you are.
Hello, my name is Kathleen Quinn. I'm the Associate Dean for Rural Health at the School of Medicine in Columbia.
Outstanding. So I was just kind of hoping this morning you'd tell us a little bit about the School of Medicine and some of the programs that you offer here.
Okay. In the mid-90s, we had a dean called Lester R. Bryant, and he was a cardiothoracic surgeon. However, he was very interested in access to health care in rural areas because he was from a rural community in Tennessee. So he implemented a program called the Rural Track Pipeline Program in 1995, and it's a comprehensive longitudinal program that there's 4 segments, and it starts with the Bryant Scholars Program. Bryant Scholars are students from rural communities in Missouri that are pre-admitted into the School of Medicine within 2 years of graduation from college. A lot of times those students don't realize that they can go into a health career because their role models are teachers or manufacturing or agriculture. And so we have area health education centers across the state that's actually a federally funded program that helps students learn about healthcare careers so they can enter into those programs in high school. In the AHEX, Area Health Education Center, we have 5 rural centers and 2 urban centers in our state. So the high school students are exposed to health careers, and then they can be pre-admitted into our School of Medicine if they're quality students and meet the admission guidelines. So while they're still undergrads, we work with them to prepare them for medical school. Not only the curriculum, but the academic environment. So they come to campus, but they're from all over the state. We can pre-admit up to 20 students. Then once they come to medical school, there's 3 programs that they can participate in across their medical school career. Other students can jump into the pipeline if they commit to those programs as their first year medical students. So the first program is between their first and second year. They go out for 4 or 6 weeks during the summer between their first and second year, and they choose a community. A hospital will sponsor the student, and we have funds from the Missouri Hospital Association that pays a small stipend to the students, and the hospitals sponsor them. They partner them with a physician, and they get to work one-on-one with a physician for that 4 to 6 weeks. It gives a student the first opportunity to really put to use their history and physical skills, and they get really excited because they understand not only the clinical aspect, but they're back in their hometown or a hometown like theirs, so they can see as young students or early in their career students what their contribution could be back into their community. Then they come back and do their second year of medical school. The first 2 years are biological sciences. The third year is their clinical year. And we have called the clerkship program, so they can do up to half of their third year out in a rural community. And right now we have 8 hospitals that sponsor students. We will have 9 next year. And the students actually move to those communities for 6 or 7 months to do their clerkship. So they could do child health, internal medicine, psychiatry, neurology, OB. And as opposed to at the academic health center where there's lots of students and residents and fellows working with one physician, the students in the rural communities, they will work one-on-one with a physician. So if they're working with an obstetrician and that physician is delivering a baby, the student is the first assist. So they can understand how care is delivered in a rural community, but they also learn about the economic impact that they can make in a rural community. They learn about public health. They learn about what aspects of rural medicine are different in this community than in an academic health center. And again, the contribution that they can make toward increased access and quality health care. Then during the 4th year, they can do electives, so they can go back out and do radiology or ophthalmology to help them kind of decide what specialty they want. we want them to, we don't push primary care, but it's more than likely that most of the students will go into primary care because those specialties are supported in a rural community. Not that an orthopedic surgeon couldn't be supported in a rural community, but they generally choose primary care. And those are the programs that we offer during medical school.
I understand. In Mexico, it's important. I know that we've heard with the recent, proposal that SSM be bought by MU Healthcare. SSM has said it's hard for them to get doctors in the rural community to hire there. Have you heard good response from this program?
From the communities?
From the communities themselves?
Yes. Oh, the communities, they see it. The communities and the physicians, they see this program as recruiting their partner or recruiting their replacement. As you know, physicians on average are getting older, and a large percentage of physicians in Missouri are over 50, and so they definitely see it as a opportunity to recruit. They get the students involved in the leadership of the hospital so they understand not only the medical community but the community at large.
You said you had some statistics that you might want to share with us today about maybe some graduation rates, and if you would share that with us, that would be great.
Okay, sure. So we divide our outcomes into students that are pre-admitted and students that enter into the pipeline separately. So the students that are pre-admitted, again, they're from rural communities, and the data goes back until 1997 when they first entered into the School of Medicine. So we have a total, and the pipeline is long, so it seems like, wow, there's been 94 Bryant Scholars that have graduated, which seems like it should be a lot higher than that. But 70% of those students are now physicians practicing in Missouri. And to give you perspective, only 18% of physicians practice in rural Missouri overall. So it's a much higher percentage rate. And then for students that opt in, 56.4% of those students are practicing in Missouri. So you want to, obviously, if you train them, you want to keep them in the state. The issue is Missouri has less residency slots than it does medical students. So we have to export many of our medical students outside of Missouri for residency. And residency is what happens for the 3 to 6 years after medical school. So if we had enough residency programs in Missouri, maybe they would all stay. Residency placement is a predictor of practice placement. So you have a chance if a student leaves the state to go to residency, they're not going to return to Missouri. They are between, a traditional student would be between the ages of 26 and 30. And they might get married and from somewhere far away and have a child, and they may never come back. So what we're working on is trying to get more residency programs, not only in Missouri, but in rural Missouri. So a couple of years ago, we started thinking about this along with the Hospital Association, the Department of Health and Senior Services, Missouri Primary Care Association, and the other medical schools. And we have a collaborative that we all work together to work on this. And Mizzou took the lead on this just because of a lot of reasons. Because we have the Health Network of Missouri, which is an entity of 6 hospitals that work closely with Mizzou with data and referrals and supply chain. So we had a consultant come in, and the consultant looked at 3 hospitals within that Health Network of Missouri, and the hospitals filled out a lot of assessment information about not only their hospitals but their communities, and the consultant determined that one of those hospitals was best at this point to start a rural residency, and it would be a family medicine residency program. So we are just at the very beginning stages of working with this hospital and the family medicine department to come together to start a residency program. So it'll probably be 2 or 3 years before a resident is actually on site. But I think that our pipeline programs because we have these students from rural areas, they will want to do their residency in a rural community. And it would only be 2 students, but the goal is not only for Mizzou to expand to other rural hospitals, but A.T. Still, KCU, Cox Residency in Springfield, all of them are thinking about expanding. So, for example, the residency program at Cox in Springfield, they might expand to do some residency work in Branson or in West Plains. And so we hope that this pilot program becomes viral. And so lots of us are working across the state to increase those rural residency programs.
Wow, very interesting, and we hope to keep in touch with you about how this pilot program goes, and hopefully you'll join us again and talk to us about that. So anything else that you want to add here this morning that maybe I've missed that you want to talk to us about the MU School of Medicine?
I think just that we're very dedicated to access and quality health issues in the state, and a physician in a small community is a $1.3 million economic impact. So just any support that we can get from not only the communities but the state in keeping our programs going is much appreciated.
Well, thank you for your time this morning. I certainly appreciate you joining us.
Thank you so much.
Thank you so much. It's been MU Healthcare, Your Health on AM 1340 KXEO.